The first step of our facial treatment is doing consultation. So I have just greeted my customer. Hello.
Hi.
What's your name?
My name is Stella.
Stella, hello. I'm Eleonora and I'll be your therapist today. Nice to meet you. We're gonna go through consultation form and make sure we take all the details. So we're gonna take her name, we're gonna put the date. I have to put my name as well here, her age, also some information about the treatment, and we're gonna take some kind of like details about her, what she thinks about her skin. So everything is on the consultation form. You're gonna have that on the course. We'll give you consultation forms, you have to fill that. We're gonna go through medical history check as well. We're gonna make sure that she doesn't have any skin disease or disorders. We shouldn't treat her, for example, eczema on the face. We can't treat the face, or any kind of like psoriasis, or if she's diabetic. So it's really important to go through all those questions. We're gonna go through some lifestyle check as well, just ask all those questions. The most important part as well is for my customer to sign the consultation form, and then I have to sign as well. We are actually ready to start with our treatment, so I'll just ask Stella to come in on the back, please. Okay, so we're gonna cover her. Comfortable. We need to make sure that our customer is really comfortable. We need to make sure also everything looks professional, tidy, clean. Okay, so I'm just going to put the couch roll. So it's really important to wash our hands. So it's really important to first of all make sure that we have everything set up. So that's my trolley. I have everything on my trolley. I've got my products here. So I prepared her. She's laying down. She's very comfortable. Head is a bit higher, which is good. She's comfortable with that position. I'm comfortable with my position. So I've put the tissue here. You're just gonna pull it back. That's it. Just make sure we've protected everything. Make sure that my hands are very clean. So I'm using gel to sanitize my hands. So the first thing we need to do is to remove the eye makeup. Stella, look up for me, please. So I'm going to just put this underneath, and I will press a bit, but very gently. So Stella, I'm gonna clean your lipstick now. Hold it with that hand, and I will just do 1 and 2 and 1 and 2, and with the other one. 1 and 2 and 1 and 2. That's it. We can just fold them now and literally do the same thing. 1, 2 and 1 and 2. That's it. Done. And then we have to dispose them in our covered bin. Good. Remove the rest. You are fine, Stella, yeah? Remove the rest, and that's absolutely everything. So once we've done that, what usually I do is remove a little bit from her makeup. So we can do that with the same actually makeup remover I've been using on the eyes, because I've got something left here. So I'm just literally going to do a little bit from her whole face, because we shouldn't forget that the cleanser, it's not a makeup removal, and very often I think our clients are very much confused about this. So we're just gonna remove a little bit from her makeup, like foundation, the blusher, with makeup removal. Eye makeup removal is quite gentle, so we can use that one, or we can just use a normal makeup removal for the whole face. So I've got my cleanser, my toner, and then my actual pads for the eye. Good. So I will be using a little bit of cleanser with the water, and then we will start from the chest, okay, and we will work all the way through the face, and make sure we spread it very evenly. So since I have spreaded now the cleanser, I need to start doing actual cleanse. So I'm gonna take a little bit of water, and I'm going to massage. So circle movements, not too much pressure is the best, and more water. So more water to emulsify it, make it very slippery. And then we will do this so we can feel like really slippery, and we make sure that we do like a proper cleanse. About 8 times on each side until we really get rid of that kind of dirt, pollution. And then finish on temples. And then I'm going to remove that cleanser, and we'll start from here. Like we will really make sure that we remove everything. So a little bit of pressure, it's okay, but not too much. And then also, every time we do it, we little bit can kind of circle our sponges. So we make sure that it's from the clean side. And then when we get to the face, I usually like to turn them around. Okay, done. And we have to now change our water and do a second cleanse. So we just did the second cleanse, so it's very important to do cleanse twice. And I will tone the skin now with a toner for sensitive skin. So it's just really, really important to tone the skin. And then I'm gonna ask my customer, Stella, how do you usually feel your skin on daily basis? Because you're with your skin 24/7. Do you feel it's oily? Do you feel it's dry? Do you feel it's sensitive? How do you feel your skin?
Dry and sensitive.
Dry and sensitive. Yes. Okay, so that's why I have chosen. Actually, I need to choose calming cleanser, toner, and also moisturizer for you, because yeah, we can see a little bit of redness, so I have to choose the correct cleanser, toner, and moisturizer for your skin type. In that case, it's gonna be more sensitive. So now we are going to do skin analysis. So we need magnifying lamp. Before that, we need to cover customer's eyes with damp cotton discs. Cotton discs on the eyes means protecting her eyes because light is quite strong. So yeah, I can see definitely here the skin is quite sensitive. She has some dilated capillaries. She also has large pores. I'm gonna just turn her on the side. So we have the, yeah, I'm gonna check now the muscle tone. So the muscle tone and the actual hydration. So if I do that and see too many lines, means hydration is not very good. I don't really see too many lines, means skin is okay, but can be improved. Yeah, that's fine. I can see also quite a lot of blackheads, especially around the nose area, which we will extract in a bit. We need to make sure that when we put the steamer, we switch the steamer on, it's away from the face, so either pointing downwards or pointing upwards, but not towards the client, because it's a safety. We need to make sure that we are quite safe. Once we have it on, so actually steaming already, I think everything is absolutely fine. So no more than 30 centimeters away from the customer's face, no less, around 30 centimeters away. So I'm just gonna turn her like that. We can also move the bed a bit upwards, but at the moment I think she's in a quite good position. Yeah, she can breathe absolutely fine, and yeah, it's a good setup. So we're gonna steam the skin, and then after steaming the skin for about a couple of minutes, I would like to add my exfoliator. I steamed it only for a couple of minutes, and I'm going to add my exfoliator, literally like that. And then once I add it, I will actually do a little bit of exfoliation with the steamer. Good. So I will just exfoliate now a bit. Very gentle circle movements. The exfoliator, you can use it on a sensitive skin as well, but I would just kind of avoid the area where the skin is very red, like the cheeks. So I'll just do the chin, the nose, and maybe just a little bit all over the actual cheeks, like that. So we're now going to remove the actual exfoliator. Before that, I can just do a little bit more. So I'll just remove the final bit from the actual exfoliator, because it can be really drying after exfoliating, just on the skin. I'll just apply the cotton disc on your eyes, Stella. 1, 2, 3. Okay, just press a bit. Good. Okay, so I've got two, at the moment, baby wipes in my hands. You can use gauze, which I sometimes find a bit more rough. You can simply use baby wipes, and you can put some witch hazel on them, literally, and start doing extraction. So at the moment on the nose, I mean, we can see between our fingers. So I'm gonna stretch a bit the skin and really focusing on those tiny little ones, that they are just coming off so easy now after the actual steam. And then we try to change every time we go over the skin. Of course, yeah, so later we can wipe the skin with some antibacterial solution for skin. We can use Clinicept, we can use witch hazel, you know, just to help with the tightening the pores after that. So you can see they just come off so easy. You can see the yellow bit here. This is sebum from the skin, just additional sebum, and obviously that sebum, when it stays in the pore for such a long period of time, it expands the pore, so the pore literally gets larger and larger, and that's why we have like larger pores, especially around the area where we have, you know, our skin producing more sebum. That's why we cannot have long nails. We can see like this, the actual blackheads. We cannot have the, you can see how many they are. I'm going to do that. I'm just using now just the toner, witch hazel spray. We can use Clinicept spray as well, something to really remove the excess sebum. Important to wear gloves, really important, because obviously there can be some bleeding, but there was nothing now here. I'm going to just use almond oil as a massage medium, spread and warm my hands, and I will talk to my client and breathe with her together. So we have to start together, and I will tell her to take a deep breath before I start. So Stella, take a deep breath. Okay, exhale. So I'm just spreading the oil now. Spread the oil really thoroughly. So now we will start with the actual massage, and I will ask Stella to take a deep breath, and we are starting. Very good, behind the neck. Just put a little bit of Vaseline on the area, and just literally put cotton discs on there, just like that, and then we can steam the face. So we just steaming the skin. She has quite sensitive cheeks, so we have put Vaseline and cotton discs on them, plus of course covering the eyes. So she'll be staying for about, you know, it depends on the, since she's quite sensitive, probably 5 minutes, 5 to 8 minutes under the steam. And yeah, that's what it is. Okay, so we will now remove the oil from the skin with toner. just remove from the neck and the chest, and I'll just turn them around. So now we're gonna apply our mask. So I will have it here close to me. Her skin is sensitive, so we're gonna apply mask for sensitive skin. We can even see some redness in certain areas, so we're just gonna count the skin. So I have my brush, and I will literally be applying from here. I like to see my strokes, so it's really perfectly applied and very evenly. And during the application as well, you're doing some kind of like lymph drainage as well, so it's very, very comfortable for the client. So she will stay for about 10 minutes with the mask. Always follow the manufacturer instructions. Usually they're listed on the pack of each product. And in our case, we're going to wait for 10 minutes and then we will remove the mask and apply the moisturizer. So during the time she's actually relaxing with the mask, I'm going to be doing a little bit of arm massage, which is really good and relaxing because I've got time to do that now. Okay. Okay, so now we will remove the mask. It's been 10 minutes. I will just remove the mask now. Are you ready? Is that okay? Yeah. So I'm going to start from the neck. So we need to press and be very, very slow. So we don't just move the mask around, but we actually remove it. So now we're gonna add the eye cream. We're done with our treatment. We just need to add the eye cream. So a little bit of eye cream, and then I'm going to apply it on the top eyelids first. And then I will ask Steva to look up for me. So I'm adding now the serum. Moisturizer. Okay, so that was the moisturizer, and of course our sunscreen. So I'm just going to add that. Okay, that's done now. So now it's done. You can open your eyes. How do you feel?
Very
okay.
Good.
So I'm going to. I will just remove the tissue. Good. And we can get that in a second. I'll help you. At the end of the treatment, I can also update my form. So I have to make sure that I will put here all the sensitivity bits. So I'm literally trying to fill that one so I know more about my customers. So next time she comes, I can just look at that and I know who I'm treating. So it's really important. Or for example, if some of my colleagues takes hers next time, they can really see what has been, what she had before and what skin type she has and what skin condition as well. So we're just gonna lift you up. Are you fine?
Yes,
yeah?
yes,
Okay. So we can just get off the bed now and I'll help you to protect your clothing. Okay, Steva, so how do you feel after the facial?
I feel really good, very relaxed.
Yeah, relaxed. Yeah, I think it was really good. I mean, I could see that you've had some sensitivity around the cheeks, so I was very careful with that area. I've applied also mask for sensitive skin because overall your face looks a bit more sensitive. That's why we didn't do steam for a very long time, and I was very gentle with exfoliation as well. So my aftercare advice is, I mean, you can come for facial once a month or once in like month and a half. at least once in 2 months you need to come for facial. It's good. It's just relaxing, helps with circulation, desquamation of dead cells. So it's very, very good. You know, we did some extraction. You've had some, comedones, but not much, just literally around the nose and chin. So we removed that one. Overall, the skin is not congested that much, which is good. I recommend you definitely to use some good serum, like antioxidant serum in the morning, followed by some good moisturizer, since you say that the skin looks a bit dry, dehydrated, and also definitely sunscreen. So it's really, really important. 24 hours post the treatment, so post today treatment, you shouldn't apply any makeup. So if you can do it for a couple of days to 3 days, that's good, but just literally cleanse, nice cleanse, morning and evening, followed by in the morning definitely a sunscreen, like moisturizer and a sunscreen, but no makeup for 24 hours at least. I don't recommend you any exercises for the next like couple of days as well. Don't be too sweaty, because it's not good. The skin's quite clean now, so I don't want you to kind of get it congested again. Overall, that's it. If you plan any holiday, just please make sure you always wear your hat and just apply sunscreen. It's not very good. The sun, is quite damaging for the skin. Do you have any questions for me?
Thank you.
Yeah?
Thank you very much.
So I'm glad that you came, and thank you so much for being
Thank you.
my
Very enjoyed it.
Thank you.
Thank you so much.